With the skyrocketing of maternal mortality rate in the U.S., a federal program was created to improve rural maternity care. However, the program has neglected Black mothers, who are at the greatest risk of suffering complications and death related to pregnancy. Where the program is going, the HRSA Rural Maternity and Obstetrics Management Strategies Program, or RMOMS, is funding $32 million to provide access and care for thousands of mothers and babies nationwide. Unfortunately, none of the sites funded by the agency serves or provide grants to mothers in the Southeast, where the largest concentration of predominantly Black rural communities are located. Where help is most needed, the lack of necessary resources makes it almost impossible for rural hospitals and care providers to apply for grants. It has been concluded that Black women living in the rural South are more likely to die or experience more severe health complications during delivery than white women living in rural areas. Rural communities do not have coverage to Medicaid or have sufficient resources to apply for grants, and the odds are not in favor for smaller, cash-strapped health organizations trying to apply. Current grantees so far, grants have gone to healthcare providers in Arkansas, Maine, Minnesota, New Mexico, South Dakota, Texas, Utah, and West Virginia, including 2 awards in Missouri. Most of the beneficiaries served are Medicaid enrollees, Texas 91%, New Mexico 59%, and the Missouri Project 22% Black patients. What's being done when asked about the lack of grants in the rural South? HRSA Associate Administrator for Rural Health Policy, Tom Morris, said that there needs to be special outreach, and that the agency wants to take the extra step that means saving women's lives. In May, the agency released a new call for applicants and relaxed requirements, including no longer requiring state Medicaid programs to be partners on initial applications. Conclusion: it is very important that the government is taking steps to investing in the most disadvantaged communities, realize their responsibility to respond to the crisis in intentional ways, and responding with grant money to the neediest places. Even with the release of grants in May, it is still unclear whether or not rural maternity programs will receive more money in 2023, and seeing as there are still many holes in the funding, more money needs to be allocated.